Kamuli District Hospital in the eastern region of Uganda also receives patients from at least 3 districts, Luka, Buyende and Kamuli. But for more than a decade, it does not have an X-ray service used to diagnose fractures and a range of organs and infections.
And this is a very, very important equipment, especially in the area of diagnosis of TB. There are many TB cases that are going undiagnosed because of lack of this equipment. Yes, which affects our treatment outcomes and our diagnostic rates. Those cases are being referred to the private facility here in Kamuli, and then others are being referred to Jinja, which is a very big distance from here.
The district health officer Aggrey Batesaki says the machines were installed in 2001 as part of the reconstruction and re-equipping exercise with funding from the Spanish government. It's been lying idle since then, despite writing to the ministry several times about the matter, but in vain.
I've informed the Ministry of Health about an X-ray machine that was given to Kamuli District more than 10 years ago, and it has never functioned at all because it came when it was faulty.
Anyway, what I can say is that we were supposed to procure about 25 X-rays in the last financial year, but we were caught up in the lengthy procurement process, and we could not conclude the procurement in time. However, we were able to save the money, so this financial year we hope to procure 25 X-ray machines, and we hope we shall distribute them to selected hospitals. Yes, that's what I can say for now.
Batesaki was interacting with a team from the In-Country Global Fund Board, Uganda Country Coordinating Mechanism for Global Fund, that were in the district to oversee programs supported by the Global Fund with focus on diseases like tuberculosis, HIV/AIDS and malaria. That was highlighted as #1 killer in the district despite recent mass distribution of free mosquito nets.
Whoever comes to the facility and complains of a headache and a fever is being put on malaria treatment, even without going through the laboratory, testing them first, which is very wrong. This contributes to wastage and misuse of anti-malarials, and people end up crying there are no malaria drugs. Yet this lack of malaria drugs has been created by us health workers, giving the malaria drugs to people who don't need them because we have not checked them to check if they have malaria in their blood to be able to give them the treatment. We just give the treatment. So we are emphasizing that test, treat and track as far as malaria is concerned, but we are lacking funding or facilitation to train all our health workers in the district in this concept of test, treat and track. And it remains #1 in causing mortality under 5.
The UCCM team also learnt of insufficient laboratory hub riders in the district, which is affecting effective treatment of tuberculosis.
There is a gene expert machine which is supposed to test TB, so it's not working to capacity because of the people who pick the hub riders who pick samples from different peripheral health facilities to bring them to the main hospital, and so they are not enough, and they pick them on days when the clinics are weak, so it's contributing on suboptimal usage of gene expert machines. So that's a problem, and I think it's something that the CCM should look at to improve.
The team also visited different service delivery points in the district, including health centers and community-based organizations, to have an insight of the areas where the Global Fund support can be improved to better complement other partners' support to avoid duplication and improve HIV, TB and malaria response efficiency and effectiveness in Uganda, among other objectives. Bernard Yiga compiled the report for UBC.